Okay, so hello, we are PNE 361, and today we will be discussing one of the most vital systems in the human body, the reproductive system. While this system is essential for human life, it also faces significant threats from diseases that we will cover in this lesson. We will explore what the reproductive system is, how it impacts our health, and diseases that threaten the health of this system as well as our bodies. With that, we will learn solutions to these issues and introduce health promotion concepts. We will also teach pericare skills for CNA students to adapt into their practice when caring for the reproductive system in patients.
By the end of the lesson, we are hoping for the audience to be able to understand the function and components of the reproductive system, recognize signs and symptoms of commonly sexually transmitted infections, otherwise known as STIs, including chlamydia, genital herpes, gonorrhea, HIV and AIDS, HPV, syphilis, and trichomoniasis, and understand the key concepts for health promotion and disease prevention for STIs, HPV, and other reproductive complications. Identify statistics and facts relating to STIs and their prevalence. Gain new knowledge and skills of how to aid in perinatal care for adults. Use analytical thinking to analyze STI statistics and name the common types of sexually transmitted infections, and use reflective thinking to consider how they may promote safer sexual practices and disease prevention within their communities. National health science standards related to the reproductive system include Centers for Disease Control Prevention guidelines on sexually transmitted infections, prevention, and treatment, Michigan Department of Health and Human Services, otherwise known as MDHHS guidelines, which provides guidelines and protocols for reproductive health services and education, such as contraceptives, STIs, and prenatal care. National Health Service Standards, otherwise known as NSCHE, provide a guideline for clear and consistent understanding of industry and post-secondary expectations for health science teachers and students, which standard 1.1.2 identifies basic structures and describes functions of both human body systems, including the reproductive system. Structures of the reproductive system, identified female or reproductive organs, and identifying male reproductive organs. Standard 1.2.1 describes the etiology, pathology, diagnosis, treatment, and prevention of common diseases and disorders such as sexually transmitted infections. Lastly, Michigan Department of Licensing and Regulatory Affairs, also known as LARA, Bureau of Community and Health Systems, BCHS, their competency 3, personal care skills, which is CMS required, has a subcategory of 3.5, which identifies personal care and hygiene needs of the resident, including bathing and performing skincare.
So the first section we're going to talk about is the female reproductive system. So this consists of the external genitalia and the internal. So the external genitalia, also known as the vulva, it includes structures such as the mons pubis, the labia majora, the labia minora, clitoris, vestibule, and the perineum. These structures are accessory structures which mainly respond to sexual arousal. Next is the internal genitalia, which includes the vagina, uterus, cervix, fallopian tubes, and the ovaries. The vagina serves as the passageway for menstrual flow, also for the penis during sexual intercourse, and it serves as the birth canal during childbirth. Next is the uterus. It's a pear-shaped structure. It is where the fertilized egg implants to the lining of the uterus, and it's also where the fetus develops. And the uterus also decreases in size as women age, so that's important to note. Next is the cervix. It's this is the portion of the uterus that extends into the vagina. Next is the fallopian tubes, which are the passageway for the ova and sperm. This is also where the ovum is fertilized, and this structure also decreases in size as women age. Next are the ovaries, which also decrease in size as women age. There is one ovary attached to each fallopian tube. It's where estrogen and progesterone are produced, as well as where female sex cells develop. And next are the breasts. These develop in response to secretions from the hypothalamus, the pituitary gland, the ovaries, and they also serve to nourish infants after birth. All right, and then some important female hormones to know are the follicle stimulating hormone, also known as FSH, the luteinizing hormone, also known as LH, and then estrogen and progesterone. So when FSH and LH are released at puberty, they affect the uterus and the ovaries, and they cause the monthly cycles to begin. So these monthly cycles include the ovarian cycle, the uterine cycle, and menopause. Or sorry, ovarian cycle and uterine cycle. And the ovarian cycle, it includes 3 phases. So the follicular phase, the ovulatory phase, and the luteal phase. And then the uterine cycle, which is also known as the menstrual cycle, also includes 3 phases: the menstrual phase, the proliferative phase, and the secretory phase. And as women age, the reproductive cycle stops, and this marks the beginning of menopause. Women will know when they have reached menopause if it has been 12 months since their last menstrual cycle. So next we'll talk about the male reproductive system. So the system also includes external and internal genitalia. External genitalia includes the penis and the scrotum. So the penis functions mainly in urination and intercourse. Male sexual responses include erection and orgasms. As men age, a common problem is difficulty in getting and keeping an erection, and this is called erectile dysfunction. The scrotum contains and protects the testes or the testicles, the epididymis, and the vas deferens. The temperature in the scrotum is cooler than the temperature in the abdominal cavity. This is because the scrotum is located outside of the body, and a cooler temperature is needed for the testicles to produce sperm. So the internal genitalia, it includes the testicles, the epididymis, the vas deferens, also known as the ductus deferens, and the prostate gland. As we said before, the testicles are where sperm and testosterone are produced, and they're found inside the scrotum. The epididymis serves as a transportation site for sperm they serve as a transportation site for sperm from the testicles to the urethra, and it's also where the sperm mature. The vas deferens, there are 2 muscular tubes. They're found at the end of, there are 2 muscular tubes, and the end of each one serves as a reservoir for sperm and tubular fluids. And they also merge with ducts from the seminal vesicle to form the ejaculatory ducts. The prostate gland is an accessory gland, and it requires sufficient levels of testosterone to be able to function properly. And then important male hormones to know are FSH, LH, and testosterone. So just a quick review of the reproductive process. It includes sperm transport, egg transport, fertilization and embryo development, and implantation. So in the sperm transport phase, there are millions of sperm, but not all of them are able to survive in this stage. After ejaculation, sperm are covered in a protective gel that protects against the acidic environment in the vagina. The sperm with the greatest motility meaning like the greatest motion or movement. They travel through the vagina to get to the uterus. And finally, they're propelled into the fallopian tubes. So next, in the egg transport stage, this is where the egg is produced in the ovary. The egg is moved into the fallopian tubes through a forward motion, and then it's transported through the tube, and this takes about 30 hours for this to occur. And in the fertilization and embryo development stage, this is where the sperm and the egg unite, and their contact is pretty random. The fertilized egg will then descend rapidly into the uterus, and the egg also has a membrane that's called the zona pellucida. It has sperm receptors that recognize human sperm, so it will protect the egg from being penetrated by another sperm once it has already been fertilized. After this, cell division takes place. A single cell embryo is called a zygote. It undergoes mitosis, which is just multiple cell divisions. This will occur for the next 7 days, and then it becomes a blastocyst, which is just like a bunch of organized cells. Next, in the last stage is implantation. Once the egg reaches that blastocyst stage, it comes out of its protective membrane, the zona pellucida, and it begins to implant into the uterus.
And this is where the students will be completing a minute paper based on the learning provided so far, and the instructions have been provided to the teacher. So now we're going to review sexually transmitted infections. First is chlamydia, which is also called the silent disease, and it's called the silent disease because it's asymptomatic, so people don't normally know that they have it, and they end up spreading it without realizing it, which highlights the importance of regular testing, especially when you have a new partner. It's a very common STI, and it's curable with treatment. It spreads through sex, which includes vaginal, oral, and anal, and with someone who's infected. Like I said, most people don't have symptoms, but if they do, they include discharge from the vagina, penis, or anus, and pain in the lower belly, pain with peeing, and to diagnose this, medical professionals use fluid or discharge from the vagina, urethra, eye, or anus, and also a urine test. Next is genital herpes. Signs and symptoms to note are small blisters that burst open, itching or burning around the genitals, and painful urination. There's typically no cure, but there's medicines that can help control the infection. Like chlamydia, most people don't have any symptoms, and except for outbreaks of sores in the genital or anal area that heal within a few weeks, and they can be caused by stress, illness, being overly tired, or sunlight. The first outbreak of genital herpes is usually the most severe, and then over time it decreases. The causes include HSV, type 1 and type 2. This virus also causes cold sores, which are around the mouth, and it spreads through contact with the break in the skin or around the mouth or genital area with an infected person. This includes vaginal or anal sex with an infected person, even if there's no sores, and oral sex with someone who has oral herpes, which is also known as cold sores. And it also can spread with between touch and when genitals touch the skin in the genital area of someone else who is infected, again without sores. Next is gonorrhea. It's a curable STI with treatment. It again spreads through sex with an infected person. Some signs and symptoms are discharge from the vagina, penis, or anus. There's pain in the testicles for males, vaginal bleeding between periods for women, pain in the lower belly, pain while peeing, and rectal pain, especially during a bowel movement, but many have no symptoms. To diagnose this, again, urine test is used as well as discharge, and if it's left untreated, it can lead to further complications, which includes pelvic inflammatory disease, and that, again, if untreated, can really damage the reproductive system and can make it hard or impossible for women to get pregnant later on in life due to the scarring in the urethra. Next is HIV and AIDS. It spreads through bodily fluids, so that includes blood, semen, vaginal secretions. It's a virus that attacks the immune system and it makes it weaker. So people with this STI are immunodeficient. HIV is the early diagnosis and treatment, which can result in long, healthy lives if caught early. But if it progresses, it turns into AIDS, which can affect someone for their entire lifetime. In AIDS, their immune system is severely weakened and they become susceptible to many serious infections and health problems. This can be contracted when any fluids enter the body, which can include sex, but also needles and tattooing, and also from mother to child during pregnancy and childbirth or breastfeeding. Signs and symptoms include fever, swollen glands, headache, rash, muscle or joint pain, and painful ulcers in the genital area or mouth. Next is HPV, which is also called genital warts. It's the most common type of STI. This can occur in different parts of the reproductive system that Michelle covered, and it's seen with raised, flat, small, large warts grouped together in a sort of cauliflower-like shape. It spreads through vaginal, oral, or anal sex, or close contact with the genital area of someone that's infected. It can take months to years for this virus to develop. So sometimes seeing the warts can mean that it was contracted earlier than thought. Syphilis is characterized by the development of chancres, which many people can, again, it'd be difficult for them to tell that they have them. It spreads through touching a sore, which is a chancre, or a wart-like lesion during sex or close contact, pregnancy, or delivery. There's 4 stages of this, which include primary, secondary, latent, and late, also called tertiary. In the primary stage, there's 1 or more painless sores that develop 3 weeks after infection, and they usually go away around 3 to 6 weeks without treatment. Secondary is the rashes on the palms of hands, soles of feet, accompanied by flu-like symptoms like fever and headache and sore throat, and wart-like lesions in the mouth, genital area, and also hair loss. In the latent stage, the person's still infected, but there's no symptoms, and this can be lifelong. And then in the late stage, if it develops into this, it can cause serious damage to the heart, blood vessels, and brain, nervous system, and it can develop 1 to 30 years after being infected. Trichomonas is the main virus that causes this is Trichomonas vaginalis. It spreads between men and women through vaginal sex, but also women to women too. Some signs and symptoms are vaginal discharge that may smell bad, itching, redness, and tenderness in around the genital area, pain when peeing, and pain during sex, bleeding during sex discharge, any discomfort, including with ejaculation with males. It also can cause fertility problems, and if untreated, can cause cervical cancer and prostate cancer.
Okay, so next we will cover the details on perineal care and why it is important. The perineal area is the diamond-shaped area between the tailbone and pubic arch. For people with female anatomy, this area consists of the vulva and anus. For people with male anatomy, this area consists of the penis, scrotum, and anus. Perineal, or also known as peri-care, involves cleansing and inspecting a patient's genital and rectal area. This practice is important to implement at least once a day for all adult patients, but even more important for patients that may be bedridden and or experiencing urinary or bile incontinence. By providing a patient with correct perineal care, this can help prevent infections such as urinary tract infections, skin irritations, and skin breakdown. And then next we'll have your instructor play a pause the presentation and play an instructional video from another CNA program that provides instructions on how to provide perineal care on female patients. And then after, we'll review the steps on how to perform the correct steps on perineal care on male and female anatomy. These steps are similar to the steps that were covered in the video. So step one, this is an important first step. Perineal care can be embarrassing for many patients and they feel exposed. To introduce yourself and explain to the patient what you're going to be doing can help them feel more comfortable. And then step two, you can ensure to provide privacy for the patient by shutting the door curtain. Step three, you want to make sure that you gather your supplies. This can be dependent on facility, but it is often a basin, skin safe cleanser, washcloths, and towels. Some facilities may use disposable wipes instead of water and soap. At this time, it is important to get lukewarm water. Be sure to feel the water before using on the patient. You can also ask the patient at this time if it is comfortable for them as well. Step four, wash and put on clean gloves. And then step five, this is where you will help position the patient on their back. This helps expose the perineal area. For women, have them bend their knees to expose the area to clean. Ensure only just enough of the area is exposed to maintain privacy. At this point, remove soiled undergarments or briefs if this applies. Step six, you can place a towel or absorbent pad underneath the patient. Step seven, gather a washcloth and soap with enough soap to clean the patient. Step eight, to clean the genital area, ensure to start each wipe from front to back in a downwards motion. Also ensure to use the clean area of the washcloth for each wipe. We want to make sure that we are cleaning until the area is clean. Wiping front to back motion helps prevent any contamination such as bacteria entering the urethra. For patients with female anatomy, it is important to include the entire vulva area while cleaning and separate the labia majora from the labia minora to ensure proper cleaning of the area. For patients with male anatomy, it is important to include the penis, urethra, and scrotum. And then step nine, take another washcloth with water to wipe away the soap. Again, following the same steps as above, wiping from front to back. And then step 10, we want to dry the patient with towels. And then step 11, to clean the rectal area, have the patient turn on their side. The patient needs a side away from you. The patient needs assistance turning. You can get help or you can help the patient or get another staff member to assist you in turning the patient. Step 12, again, following steps 7, 8, and 9 to clean the rectal area. We want to make sure that we are cleaning this area until it is clean. And then step 13, dry the patient with towels. And then step 14, assist the patient into a comfortable position, disposing of dirty linens and supplies, and then removing your gloves and washing your hands. And then before you leave, ensure the patient has collet and the bed is locked in the lowest position before leaving.
Next, we will be doing a reproductive case study and how the role pertains to the certified nurse assistant. So the case study is as follows. The 48-year-old female patient presents to the clinic with pain upon urination, urinary frequency, cloudy, and odorous urine. She states that she has been having painful urination for the past 3 days, and it started after sexual intercourse. Patient's vital signs read as temperature 100.8 Fahrenheit, heart rate 120, blood pressure 108/70, respiratory rate 20, and SpO2 98%. So as the certified nurse assistant, what tasks did you anticipate the nurse delegating to you? So a case study like this is important with the reproductive system and pericare, as Jackie just spoke about. So one of the main things we want to do is see their vital signs, and we might want to retake the vital signs for the nurse and then report it to the nurse to see if they get better or worse. From there, we want to monitor their I's and O's. So we want to do their intake and output just to see the characteristics of their urine, how much their urine is, if there's any smell with their urine, and just the amount overall. Also, we want to do a urine sample. So the nurse may delegate to you to do a urine sample. which will be ordered by the provider to determine what kind of infection the patient has or what kind of sexually transmitted infection. So when retrieving a urine sample, you should follow your facility's protocols and obtain the sample in a container. This will then be sent to the lab with the patient's name and date of birth through tubing system, or somebody might come by and pick it up. Also, with this kind of case study, you should anticipate the nurse asking you to help the patient with ambulation. So in the case study, it says that the patient has urinary frequency, so this may increase the patient's likelihood of falls. So it'll be important for the CNA to ensure the room is clean and uncluttered. Also, if your patient has immobilization or balance gait problems, you just want to help them overall reach the bathroom in time so they can urinate. And then proactive toileting, this is also with kind of the system with the ambulation. So you want to do your hourly routing and then asking your patient like if you can assist them to the bathroom, and also just checking if they have another like a catheter or something like that. You want to check that catheter as well to make sure they're urinating. And finally, the pericare, as Jackie stated before, this is optimal if the patient has an infection, just prevent it progressing any further. And also, if they have a catheter, preventing like a catheter associated UTI.
So there are many different aspects for health promotion and disease prevention. We'll start with a way to encourage health promotion being that while preventing STIs and STDs is to engage in comprehensive sex education. So with this, it's important to emphasize the use of condoms to reduce the transmission of any STDs and to be aware of safe sex practices. So while abstinence would be the most certain way to prevent disease spread, there are ways to reduce transmission of STDs between people who are sexually active by reducing number of partners and being transparent with any partners about sexual history. So in the case that one partner does have an STI or STD, they can let the other person know so they can go and get tested and get any treatment if necessary. Another key concept is to provide informative STI and STD education so that individuals are able to recognize the symptoms of STDs as outlined in previous slides and can receive the care that they need as early as possible if they do happen to identify any specific symptoms. In the event that an STI or STD is diagnosed, it's important to be treated as quickly as possible. As of right now, some current treatments are medications for different STIs based on their source. So for bacterial STIs like syphilis, chlamydia, and gonorrhea, a provider would prescribe an antibiotic. And then for viral STIs like herpes, HPV, and HIV, a provider would prescribe an antiviral medication.
In addition, vaccines and other biomedical interventions have been underway to prevent common STIs. There are currently vaccines available for HPV and hepatitis B virus. For HSV2, a micro gel containing tenofovir was found to have the risk of HSV2 infection in one clinical trial. People who have been infected have a threefold increased risk of acquiring HIV infection. Basic confidential STI services need to be integrated into existing primary health care, reproductive health, and HIV care settings. In low-income countries, STIs and their complications are one of the top 5 reasons that adults seek health care. STI prevention can be incorporated into family planning services to maximize dual protection, messaging, and interventions. Integration will not only benefit patients seeking quality care for STI-related symptoms, but will also provide the most efficient and cost-effective avenue for scaling up STI prevention efforts. These are our references. Thank you all for engaging in our presentation, and we'll now go on to our Kahoot activity.